NGN NCLEX RN Practice Questions and Answers 2026. Question 1. A client at 9 weeks gestation comes for an initial prenatal visit. On assessment, the nurse discovers this is her second pregnancy. Her first pregnancy resulted in a spontaneous abortion. She is 28 years old, in good health, and works full-time as an elementary school teacher. This information alerts the nurse to which of the following. Here are the options. Option A. An increased risk in maternal adaptation to pregnancy. Option B. The need for anticipatory guidance regarding the pregnancy. Option C. The need for teaching regarding family planning. Option D. An increased risk for subsequent abortions. The correct answer is option B. The need for anticipatory guidance regarding the pregnancy. A. D. There are no data to support this. B. Anticipatory guidance and health maintenance is a first-line defense in the promotion of healthy mothers and healthy babies. C. There are no data to support this at this time. This will be a concern later. Question 2. A client is pleased about being pregnant, yet states, "It is really not the best time, but I guess it will be okay." The nurse's assessment of this response is, here are the options. Option A. Initial maternal-infant bonding may be poor. Option B. Client may have a poor relationship with her husband. Option C. This response is normal in the first trimester. Option D. This response is abnormal to be reevaluated at the next visit. The correct answer is option C. This response is normal in the first trimester. Ambivalence is normal during the first trimester. Rubin addresses the issue of not now in the first trimester. The statement still leaves room for exploration. B. There are no data to support this. This statement by the mother still leaves room for exploration. C. Ambivalence is normal during the first trimester. Rubin addresses the issue of not now. This fact should be shared with the mother during further exploration of the comment. D. It is not abnormal. If it were, another month would also be too long to wait. Question 3. A client at 6 months gestation complains of tiredness and dizziness. Her hemoglobin level is 10 g/dl and her hematocrit value is 32%. Her nutritional intake is assessed as sufficient. The most likely diagnosis is, here are the options. Option A. Iron deficiency anemia. Option B. Physiological anemia. Option C. Fatigue due to stress. Option D. No problem indicated. The correct answer is option A. Iron deficiency anemia. This clinical situation is indicative of iron deficiency anemia because the client has inadequate nutritional intake. Her blood volume is increasing faster than her red blood cell volume. Anemia is present in the second trimester when the hemoglobin level is 10.5 and the hematocrit value falls below 35%. She needs increased iron supplements with follow-up. B. The client's values are below levels for physiological anemia. C. The client is fatigued because of a low hemoglobin level. D. Her hemoglobin level is low and will probably decrease even more when the blood volume peaks at 28 weeks. Question 4. In counseling a client, the nurse emphasizes the danger signals during pregnancy. On the next visit, the client identifies which of the following as a danger signal that should be reported immediately. Here are the options. Option A. Backache. Option B. Leaking of clear yellow fluid from breasts. Option C. Constipation with hemorrhoids. Option D. Visual changes. The correct answer is option D. Visual changes. A backache is a common complaint during pregnancy. Proper body mechanics, pelvic rock, back rubs, and other comfort measures should relieve the discomfort. In the presence of uterine contractions, the backache would radiate to the lower abdomen. The colostrum is normal and can be present anytime in the second half of pregnancy. C. Constipation and hemorrhoids are common and do need attention, but they do not constitute a dangerous situation. D. Visual changes are possibly related to PIH. The client should be assessed immediately to rule out or prevent worsening of PIH. Question 5. The client will be more comfortable and the results more accurate when the nurse prepares the client for Leopold's maneuvers by having her. Here are the options. Option A. Empty her bladder. Option B. Lie on her left side. Option C. Place her arms over her head. Option D. Force fluids 1 hour prior to procedure. The correct answer is option A. Empty her bladder. A full bladder would cause discomfort and possible urinary incontinence during the exam. B. The left side lying position would not accommodate the exam. The head of the exam table or bed can be slightly elevated to prevent supine hypotension. C. Arms extended over the head would cause the abdomen to be tighter and less easily palpable. D. Forcing fluids would encourage a full bladder, which is not desired for the exam. Question 6. Before giving Methergin postpartum, the nurse should assess the client for. Here are the options. Option A. Decreased amount of lochial flow. Option B. Elevated blood pressure. Option C. Flushing. Option D. Afterpains. The correct answer is option B. Elevated blood pressure. A Methergin is given to contract the uterus and to control postpartum hemorrhage. Therefore, lochial flow should decrease. B. Methergin may elevate the blood pressure. A client with an elevated blood pressure should not receive Methergin, but she could be given oxytocin if necessary. C. Flushing is not a side effect of Methergin. D. Afterpains are increased with Methergin usage. The client should be informed that this is a normal response. Question 7. A 24 hours postpartum client complains of discomfort at the episiotomy site. On assessment, the nurse notes the episiotomy is without signs of infection. To relieve the discomfort, the nurse should first. Here are the options. Option A. Assist her with a sitz bath. Option B. Administer the prescribed medication for pain. Option C. Teach her Kegel exercises. Option D. Apply an ice pack. The correct answer is option A. Assist her with a sitz bath. A warm, moist heat will promote circulation and provide comfort. A sitz bath should be tried before medication is given. B. Pain medication can be given when other comfort measures, such as a sitz bath and topical applications, are ineffective. C. Kegel exercises facilitate sitting by decreasing tension on the episiotomy. They will not be effective for pain control or sustained comfort level. D. Ice packs are appropriate to apply in the first 12 hours post-delivery to produce vasoconstriction and to reduce edema to the area. Question 8. The nurse explains perineal hygiene self-care postpartum to the client. She should be instructed to. Here are the options. Option A. Wear gloves for the procedure. Option B. Place and adjust the pad from back to front. Option C. Cleanse and wipe the perineum from front to back. Option D. Protect the outer surface of the pad from contamination. The correct answer is option C. Cleanse and wipe the perineum from front to back. A perineal hygiene is a clean procedure and does not require the client to wear gloves. A care provider should wear gloves to adhere to universal precautions. B. The pad should be applied from front to back to prevent contamination of the birth canal or urinary tract from rectal bacteria. C. Wiping from front to back and discarding the wipe prevents contamination of the urinary tract and birth canal from rectal bacteria. D. The inner surface of the pad should not be touched to maintain asepsis. Question 9. In teaching the client about proper umbilical cord care, the nurse recommends that. Here are the options. Option A. Petrolatum be placed around the cord after the sponge bath. Option B. A belly binder be applied to prevent umbilical hernia. Option C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. Option D. The cord clamp be left on until the cord stump separates. The correct answer is option C. The area be cleansed at diaper changes with alcohol and inspected for redness or drainage. A petrolatum does not allow the cord to dry and will encourage infection. The belly binders do not facilitate drying of the cord and will encourage abdominal relaxation. C. Frequent applications of alcohol will facilitate drying and discourage infection. D. The cord clamp can be removed in 24 hours. Leaving it on is cumbersome and could pull on the cord unnecessarily. Question 10. A baby is circumcised. Immediate postoperative care should include. Here are the options. Option A. Applying a loose diaper. Option B. Keeping the baby NPO for 4 hours to avoid vomiting. Option C. Changing the dressing frequently using dry, sterile gauze. Option D. Taking the baby to his mother for cuddling. The correct answer is option D. Taking the baby to his mother for cuddling. A pressure diaper should be applied to discourage hemorrhage. B. The baby can be fed by his mother soon after the procedure, once it is assessed that he is not in any distress and is stable. C. Dressing changes should not be dry. Dry dressing will stick. D. Cuddling after the procedure will hopefully quiet the baby. Feeding is also important if his feeding was withheld prior to the procedure or it is time for a feeding. Question 11. A 28-year-old multigravida has class Roman II heart disease. At her prenatal visit at 34 weeks gestation, all of the following observations are made, which would require intervention. Here are the options. Option A. Weight gain of 2 kg in 4 weeks. Option B. Blood pressure of 128/78. Option C. Subjective data, shortness of breath after showering. Option D. Ankle edema reported present in late afternoon and evenings. The correct answer is option C. Subjective data, shortness of breath after showering. A. This is not an excessive weight gain indicative of fluid retention. B. The blood pressure is within normal range. C. Showering should not cause shortness of breath. This could be a sign of cardiac decompensation. D. Dependent ankle edema is normal late in the day among pregnant women. Progressive edema would be a dangerous development. Question 12. A client is admitted to the labor room. She is dilated 4 cm. She is placed on electric fetal monitoring. Which of the following observations necessitates notifying the physician? Here are the options. Option A. Contractions every 2 minutes, lasting 100 seconds. Option B. Fetal heart decelerations during a contraction. Option C. Beat-to-beat variability between contractions. Option D. Fetal heart decelerations at the beginning of contractions. The correct answer is option A. Contractions every 2 minutes, lasting 100 seconds. A. These are tetanic in nature and can cause rupture of the uterus. B. The FHR decreases during contractions owing to vasoconstriction and should recover after the contraction. C. Beat-to-beat variability is a normal finding and demonstrates fetal well-being. D. The FHR may decrease at the beginning of a contraction owing to head compression. Question 13. A client has been in labor 10 hours and is becoming very tired. She has dilated to 7 cm and is at 0 station with the fetus in a right occipito-posterior position. She is complaining of severe backache with each contraction. One comfort measure the nurse can employ is to. Here are the options. Option A. Place her in knee-chest position during the contraction. Option B. Use fluid during the contraction. Option C. Apply strong sacral pressure during the contraction. Option D. Have her push with each contraction. The correct answer is option C. Apply strong sacral pressure during the contraction. This measure is inappropriate. The knee-chest position is employed to take pressure off the cord. The fluid is a comfort measure, but not the one that will contribute most to the relief of backache caused by a posterior position. C. Sacral pressure will counteract the pressure created by the position of the fetal head. D. The client is not completely dilated. Pushing is contraindicated until the second stage of labor. Question 14. The nurse in the mental health center is instructing a depressed client about the dietary restrictions necessary in taking her medication, which is a monoamine oxidase MAO inhibitor. Which of the following is she restricting from the client's diet? Here are the options. Option A. Cream cheese. Option B. Fresh fruits. Option C. Aged cheese. Option D. Yeast bread. The correct answer is option C. Aged cheese. A cream cheese does not contain tyramine, which might cause a hypertensive crisis. B. Fresh fruits do not contain tyramine, which might cause a hypertensive crisis. C. Aged or matured cheese combined with a monoamine oxidase predisposes the client to a hypertensive crisis. D. Bread products raised with yeast do not contain tyramine. Question 15. A client suffering from schizophrenia has been taking chlorpromazine thorazine for 6 months. On one of his follow-up visits to the mental health center, the nurse reports to the physician that he has developed tardive dyskinesia. Which of the following symptoms might she have observed in the client to support this conclusion? Here are the options. Option A. High fever, tachycardia, stupor, renal failure. Option B. Lip smacking, chewing, blinking, lateral jaw movements. Option C. Photosensitivity, orthostatic hypotension, dry mouth. Option D. Constipation, blurred vision, drowsiness. The correct answer is option B. Lip smacking, chewing, blinking, lateral jaw movements. These symptoms are found in clients with neuroleptic malignant syndrome. These symptoms are found in clients with tardive dyskinesia. These are normal side effects found in clients taking antipsychotic medications. These are also normal side effects found in clients taking antipsychotic medications. Question 16. On morning rounds, the nurse found a manic-depressive client who is taking lithium in a confused mental state, vomiting, twitching, and exhibiting a coarse hand tremor. Which one of the following nursing actions is essential at this time? Here are the options. Option A. Administer her next dosage of lithium and then call the physician. Option B. Withhold her lithium and report her symptoms to the physician. Option C. Place her on NPO to decrease the excretion of lithium from her body and call the physician. Option D. Contact the lab and request a lithium level in 30 minutes and call the physician. The correct answer is option B. Withhold her lithium and report her symptoms to the physician. A. The client has lithium toxicity and the nurse must withhold further dosages. B. Because of her level of toxicity, further lithium could cause coma and death. The nurse needs further orders from the physician to stabilize the client's lithium level. C. Ensuring adequate intake of sodium chloride will promote excretion of lithium and will assist in managing the client's lithium toxicity. D. A lithium blood level must be drawn immediately to determine the seriousness of the toxicity and to provide the physician with data for medical orders. Question 17. In acute episodes of mania, lithium is effective in 12 weeks, but it may take up to 4 weeks or even a few months to treat symptoms fully. Sometimes an antipsychotic agent is prescribed during the first few days or weeks of an acute episode to manage severe behavioral excitement and acute psychotic symptoms. In addition to the lithium, which one of the following medications might the physician prescribe? Here are the options. Option A. Diazepam Valium. Option B. Haloperidol. Option C. Sertraline Zoloft. Option D. Alprazolam Xanax. The correct answer is option B. Haloperidol. A diazepam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. B. Haloperidol is an antipsychotic medication and may be used until the lithium takes effect. C. Sertraline is an antidepressant and is used primarily to reduce symptoms of depression. D. Alprazolam is an anti-anxiety medication and is not designed to reduce psychotic symptoms. Question 18. The healthcare team determines that an elderly client has had progressive changes in memory over the last 2 years that have interfered with her personal, social, or occupational functioning. Her memory, learning, attention, and judgment have all been affected in some way. These symptoms describe which of the following conditions? Here are the options. Option A. Dementia. Option B. Parkinsonism. Option C. Delirium. Option D. Mania. The correct answer is option A. Dementia. These changes are common characteristics of dementia. B. Parkinson's disease affects the muscular system. Progressive memory changes are not presenting symptoms. C. Delirium includes an altered level of consciousness, which is not found in dementia. D. Mania includes symptoms of hyperactivity, flight of ideas, and delusions of grandeur. Question 19. A husband and wife and their 2 children, age 9 and age 5, are requesting family therapy. Which of the following strategies is most therapeutic for the nurse to use during the initial interaction with the family? Here are the options. Option A. Always allow the most vocal person to state the problem first. Option B. Encourage the mother to speak for the children. Option C. Interpret immediately what seems to be going on within the family. Option D. Allow family members to assume the seats as they choose. The correct answer is option D. Allow family members to assume the seats as they choose. One will always hear what the most vocal person has to say. It is best to start with the quietest family member to encourage that person to express emotions. All family members are encouraged to speak for themselves. C. In the initial family assessment, only data collection occurs. Interpretations are made later. D. Allowing family members to choose their own seats will assist the nurse in assessing the family system and in determining who feels closer to whom. Question 20. In healthcare settings, nurses must be familiar with primary, secondary, and tertiary levels of care. As a nurse in the community, which of the following interventions might be a primary prevention strategy? Here are the options. Option A. Crisis intervention with an intoxicated teenager whose mother just committed suicide. Option B. Referring a client who has been on a detoxification unit to a rehabilitation center. Option C. Teaching 5th grade children the harmful effects of substance abuse. Option D. Counseling a client with post-traumatic stress disorder. The correct answer is option C. Teaching 5th grade children the harmful effects of substance abuse. If the teenager is already coping ineffectively and requires early detection and treatment, which is secondary prevention, B. The client must be sent to a rehabilitation unit, which requires tertiary prevention. C. Reducing the incidence of disease through education supports primary prevention. D. A client with identified symptoms of post-traumatic stress disorder requires intervention by treatment. Question 21. While the nurse is taking a male client's blood pressure, he makes flirtatious remarks to her. The nurse will handle this effectively if she. Here are the options. Option A. Politely tells the client, "Keep your hands off." Option B. Ignores the remarks and hopes he will not try it again. Option C. Confronts the remarks but attempts not to reject the client. Option D. Leaves the room in order to compose herself. The correct answer is option C. Confronts the remarks but attempts not to reject the client. A. This response does not recognize normal feelings of attraction and rejects the client. B. By ignoring the situation, the nurse has not set limits to discourage other remarks or perhaps more sexually aggressive behavior. C. By confronting the remarks, she can recognize that his feelings of attraction may be normal but are not appropriate within the context of their nurse-client relationship. D. Leaving the room does not deal with setting limits for future interactions. Question 22. A client is a victim of domestic violence. She is now receiving assistance at a shelter for battered women. She tells the nurse about the cycle of violence that she has been experiencing in her relationship with her husband of 5 years. In the tension-building phase, the nurse might expect the client to describe which of the following. Here are the options. Option A. Promises of gifts that her husband made to her. Option B. Acute battering of the client, characterized by his volatile discharge of tension. Option C. Minor battering incidents, such as the throwing of food or dishes at her. Option D. A period of tenderness between the couple. The correct answer is option C. Minor battering incidents, such as the throwing of food or dishes at her. A. This description is characteristic of the honeymoon or respite phase. B. This description is characteristic of the battering phase. C. This description is characteristic of the tension-building phase prior to the volatile discharge of tension found in the battering phase. D. This description is characteristic of the honeymoon or respite phase. Question 23. Which of the following symptoms might the nurse observe in a client with a lithium blood level over 2.0? Here are the options. Option A. Fine hand tremor, headache, mental dullness. Option B. Vomiting, impaired consciousness, decreased blood pressure. Option C. Polyuria, polydipsia, edema. Option D. Gastric irritation, nausea, diarrhea. The correct answer is option B. Vomiting, impaired consciousness, decreased blood pressure. A. These symptoms are acute, common, and usually harmless central nervous system side effects of lithium. B. These symptoms of lithium toxicity are usually dose-related. C. These symptoms are acute, common, and usually harmless renal side effects of lithium. D. These symptoms are acute, common, and usually harmless gastrointestinal side effects of lithium. Question 24. A psychiatric nurse is providing an orientation to a new staff nurse. She reminds the nurse that psychiatrists often use categories of medications and that it is important that she recall that some categories of medications have synonyms. Another name used to describe minor tranquilizers is which of the following? Here are the options. Option A. Antipsychotic medications. Option B. Antidepressant medications. Option C. Anti-anxiety medications. Option D. Anti-mania medication. The correct answer is option C. Anti-anxiety medications. Antipsychotic medications are also known as major tranquilizers. B. Antidepressants fall into different categories, such as the tricyclics or the MAO inhibitors. C. Anti-anxiety medications are also known as minor tranquilizers. D. Anti-mania medications are those such as lithium and lithium carbonate lithobid. Question 25. The nurse has been caring for a 16-year-old female who recently experienced date rape. After having had crisis intervention and been hospitalized for 2 weeks, the nurse knows that the client is effectively coping with the rape when she tells the nurse. Here are the options. Option A. I know it was my fault that it happened, because I shouldn't have been out so late. Option B. If I had not worn that sexy dress that night, he wouldn't have raped me. Option C. I know my date just had so much passion he couldn't handle me saying no. Option D. I know now that it was not my fault, but I want to continue counseling after my discharge. The correct answer is option D. I know now that it was not my fault, but I want to continue counseling after my discharge. If this response does not show any insight, the client falsely assumes that she is responsible for the rape. B. The client continues to falsely assume responsibility for the rapist's behavior. C. The client believes falsely that rape is an act of passion rather than one of violence, control, and domination. D. The client has insight into the rape. She does not believe it was her fault and shows good judgment in deciding to continue with counseling after discharge. Question 26. A 42-year-old male client has been treated at an alcoholic rehabilitation center for physiological alcohol dependence. The nurse will be able to determine that he is preparing for discharge and is effectively coping with his problem when he shares with her the following information. Here are the options. Option A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. Option B. I know that I can only drink 1 or 2 drinks at social gatherings in the future, but at least I don't have to continue AA. Option C. I really wasn't addicted to alcohol when I came here. I just needed some help dealing with my divorce. Option D. It really wasn't my fault that I had to come here. If my wife hadn't left, I wouldn't have needed those drinks. The correct answer is option A. I know that I will not ever be able to socially drink alcohol again and will need the support of the AA group. The client has insight into the severity of his alcohol addiction and has chosen one of the most effective treatment strategies to support him, Alcoholics Anonymous. B. The client is still using denial and is not dealing with his alcohol addiction. C. The client is exhibiting denial about his alcohol addiction and projecting blame on his divorce. D. The client is projecting blame onto his wife for being in the hospital while still denying his alcohol addiction. Question 27. Degenerative disorders are attributed to many factors. As a nurse assigned to a convalescent home, one must often educate families about how such conditions occur. Which of the following statements might the nurse need to explore when a daughter tries to explain to her mother what caused her degenerative disorder? Here are the options. Option A. Some folks believe that aging causes this, mother. Option B. Perhaps it's the way your parents used those double-blind messages, mother. Option C. I know some people who are having this problem and they were exposed to chemicals at work, mother. Option D. It can be caused by lots of things, toxic agents and even alcohol, mother. The correct answer is option B. Perhaps it's the way your parents used those double-blind messages, mother. Aging is a factor in the cause of degenerative disorders. The double-blind messages may be found in the histories of families of individuals who develop schizophrenia, but they are not related to degenerative disorders. C. Chemicals, toxic agents in work environments are predisposing factors to degenerative disorders. D. Alcohol causes some degenerative disorders, such as Wernicke's syndrome. Question 28. A family is experiencing changes in their lifestyle in many ways. The invalid grandmother has moved in with them. The couple have a 2-year-old son by their marriage, and the wife has 2 children by her previous marriage. The older children are in high school. In applying systems theory to this family, it is important for the nurse to remember which of the following principles. Here are the options. Option A. The parts of a system are only minimally related. Option B. Dysfunction in one part affects every other part. Option C. A family system has no boundaries. Option D. Healthy families are enmeshed. The correct answer is option B. Dysfunction in one part affects every other part. If the parts of a system are interrelated, any change in any part of the system affects all other parts. C. A family system, like any other system, has boundaries. D. Healthy families are neither enmeshed nor disengaged. Question 29. The nurse is trying to help a mother understand what is happening with her son who has recently been diagnosed with paranoid schizophrenia. At present, he is experiencing hallucinations and delusions of persecution and suffers from poor hygiene. The nurse can best help her understand her son's condition by which of the following statements? Here are the options. Option A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. Option B. Has anyone in your family ever had schizophrenia? Option C. If your son has a twin, he probably will eventually develop schizophrenia, too. Option D. Some of his symptoms may be a result of his lack of a strong mother-child bonding relationship. The correct answer is option A. Sometimes these symptoms are caused by an overstimulation of a chemical called dopamine in the brain. The most plausible theory to date is that dopamine causes an overstimulation in the brain, which results in the psychotic symptoms. B. This statement will only create anxiety in the mother, and the genetic theory is only one of the etiological factors. C. This statement will cause the mother much alarm, and nothing was mentioned about any other child. D. The mother-child relationship is one of the previous theories examined, but it's not one to be emphasized, thereby causing a lot of anxiety for the mother. Question 30. A male client is experiencing auditory hallucinations. His nurse enters the room and he tells her that his mother is talking to him, and he will take his medicine after she leaves. The nurse looks around the room and sees that she and the client are the only ones in the room. The nurse's most therapeutic response will be, Here are the options. Option A. I don't see your mother in the room. Let's talk about how you're feeling. Option B. Okay, I'll come back later when you're feeling more like taking your medicine. Option C. She may be here, but I can't see her. Option D. Why don't you finish talking to her and I'll wait? The correct answer is option A. I don't see your mother in the room. Let's talk about how you're feeling. This response uses the principle of reality orientation by the nurse telling the client that he or she does not see anything, but it does recognize his feelings. B. This response does not make it clear that the nurse does not see anyone else in the room, and the nurse leaves the client alone to continue hallucinating. C. This response leaves room for doubt. The nurse is further confusing the client by this statement. D. This response reinforces the hallucination and implies that the nurse sees his mother, too. Question 31. A female client with major depression stated that life is hopeless and not worth living. The nurse should place highest priority on which of the following questions? Here are the options. Option A. How has your appetite been recently? Option B. Have you thought about hurting yourself? Option C. How is your relationship with your husband? Option D. How has your depression affected your daily living activities? The correct answer is option B. Have you thought about hurting yourself? Although eating habits are important to assess, they are less important than suicidal intent. B. Maintenance of the client's life is the priority. Assessment of suicidal intent is imperative. C. Relationships and support systems are an important part of assessment, but they are less important than suicidal intent. D. Daily living activities will give additional information about the level of depression and are less significant than suicidal intent, although this information may give additional information about the actual plan for a suicidal attempt. Question 32. A client presented herself to the mental health center describing the following symptoms: a weight loss of 20 lb in the past 2 months, difficulty concentrating, repeated absences from work due to fatigue, and not wanting to get dressed in the morning. She leaves her recorded message on her telephone and has lost interest in answering the phone or doorbell. The nurse's assessment of her behavior would most likely be, here are the options. Option A. Deep depression. Option B. Psychotic depression. Option C. Severe anxiety. Option D. Severe depression. The correct answer is option D. Severe depression. A client in deep depression would have been brought to the mental health center and would not be physically able to seek help for herself. B. She is not manifesting psychotic symptoms in her behaviors. C. The client's symptoms are more indicative of depression than anxiety. D. Although the client was able to bring herself to the mental health center, the extent of her weight loss and the interference of symptoms with activities of daily living indicate that she is severely depressed. Question 33. A 48-year-old male client is hospitalized with mild ascites, bruising, and jaundice. He has a 20-year history of alcohol abuse. The client is diagnosed with cirrhosis. His serum ammonia level is high, indicating hepatic encephalopathy. He has esophageal varices. Which of the following may cause the varices to rupture? Here are the options. Option A. Lifting heavy objects. Option B. Walking briskly. Option C. Ingestion of barbiturates. Option D. Ingestion of antacids. The correct answer is option A. Lifting heavy objects. Lifting heavy objects will increase intrathoracic pressure, thus placing the client at risk for rupturing esophageal varices. B, C. D. This activity will not cause an increase in intrathoracic pressure. Question 34. Due to his prolonged history of alcohol abuse, an alcoholic client will most likely have deficiencies of which of the following nutrients? Here are the options. Option A, vitamin C and zinc. Option B, folic acid and niacin. Option C, vitamin A and biotin. Option D, thiamine and pyrazidine. The correct answer is option D, thiamine and pyrazidine. A chronic alcoholism can lead to deficiencies of B-complex vitamins including thiamine and pyrazidine. B. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B-complex. C. Chronic alcoholism can lead to deficiencies of vitamins A, D, K, and B-complex. D. Vitamins A, D, K, and B require bile salts to be absorbed from the gastrointestinal tract. A damaged liver does not form bile salts. Question 35. The physician of an alcoholic client places him on a low-protein, high-carbohydrate diet. When choosing his menu, the client's best choice from the items below would be, here are the options. Option A, liver and onions, macaroni and cheese, tea with sugar. Option B, baked chicken, baked potato with bacon bits, milk. Option C, waffles with butter and honey, orange juice. Option D, cheese omelette with ham and mushrooms, milk. The correct answer is option C, waffles with butter and honey, orange juice. A, B, D. These foods are high in protein, which needs to be restricted. C. Serum ammonia levels can be decreased by restricting dietary protein intake. Waffles, honey, and orange juice are high in carbohydrate and low or completely lacking in protein. Butter, a concentrated fat, will provide extra calories. Question 36. A chronic alcoholic client's condition deteriorates and he begins to exhibit signs of hepatic coma. Which of the following is an early sign of impending hepatic coma? Here are the options. Option A, hiccups. Option B, anorexia. Option C, mental confusion. Option D, fetor hepaticus. The correct answer is option C, mental confusion. Hiccups are not a sign of impending hepatic coma. The anorexia is not a sign of impending hepatic coma. C. One of the earliest symptoms of hepatic coma is mental confusion. Asterixis, a flapping tremor of the hand, may also be seen. D. This sign is associated with the later stages of hepatic coma. Fetor hepaticus, a characteristic odor on the breath that smells like acetone, may sometimes be noted when the liver fails. Question 37. The physician of a client diagnosed with alcoholism orders neomycin 0.5 GQ6H to prevent hepatic coma. Neomycin decreases serum ammonia levels by. Here are the options. Option A, decreasing nitrogen-forming bacteria in the intestines. Option B, acidifying colon contents by causing ammonia retention in the colon. Option C, decreasing the uptake of vitamin D, thereby drawing more water into the colon. Option D, irritating the bowel and promoting evacuation of stool. The correct answer is option A, decreasing nitrogen-forming bacteria in the intestines. A neomycin interferes with protein synthesis in the bacterial cell, causing bacterial death. Neomycin reduces the growth of the ammonia-producing bacteria in the intestines and is used for the treatment of hepatic coma. B. This choice describes the action of lactulose, another drug commonly used to decrease systemic ammonia levels. C. Neomycin's action does not decrease uptake of vitamin D to reduce serum ammonia levels. D. Bowel irritation with diarrhea is more likely to occur with administration of lactulose rather than of neomycin. Besides, diarrhea is a side effect of a drug, not the action of the drug. Question 38. A 26-year-old male client is brought by his wife to the emergency department, ED unconscious. Blood is drawn for a stat blood count CBC, fasting blood sugar level, and electrolytes. An indwelling urinary catheter is inserted. He has a history of type 1 diabetes, insulin-dependent diabetes mellitus item. A diagnosis of ketoacidosis is made. Stat lab values reveal a blood sugar level of 520 mg/dl. Which of the following should the nurse expect to administer in ER? Here are the options. Option A. D50W by Roman 4 push. Option B. NBH insulin SC. Option C. Regular insulin by Roman 4 infusion. Option D. Sweetened grape juice by mouth. The correct answer is option C. Regular insulin by Roman 4 infusion. This action would further increase the client's blood sugar. B. NPH insulin is an intermediate-acting insulin with an average of 46 hours before onset of action. The client needs insulin that will act immediately. During a ketoacidotic state, the client is dehydrated, so any insulin administered as C will be poorly absorbed. C. Regular insulin is the fastest-acting insulin. When given Roman 4, it will immediately act to decrease blood sugar. Regular insulin is given to decrease blood glucose levels by promoting metabolism of glucose, inhibiting lipolysis and formation of ketone bodies. D. This action would further increase the client's blood sugar. Question 39. A client with item is given Roman 4 insulin for a blood glucose level of 520 mg/dl. Life-threatening complications may occur initially, so the nurse will monitor him closely for serum. Here are the options. Option A. Chloride level of 99 mx/L. Option B. Sodium level of 136 mx/L. Option C. Potassium level of 3.1 mx/L. Option D. Potassium level of 6.3 mx/L. The correct answer is option D. Potassium level of 6.3 mx/L. If the chloride level is within acceptable limits. B. The sodium level is within acceptable limits. C. This value indicates hypokalemia rather than the hyperkalemia that occurs during diabetic ketoacidosis. D. When diabetic ketoacidosis exists, intracellular dehydration occurs and potassium leaves the cells and enters the vascular system, thus increasing the serum level beyond an acceptable range. When insulin and fluids are administered, cell walls are repaired and potassium is transported back into the cells. Normal serum potassium levels range from 3.55.0 mx/L. Question 40. An item client condition stabilizes. He begins to receive a daily injection of NPH insulin at 6:30 a.m. The nurse can most likely expect a hypoglycemic reaction to occur the same day at. Here are the options. Option A. 8:30 a.m. 10:30 a.m. Option B. 2:30 p.m. 4:30 p.m. Option C. 7:30 p.m. 9:30 p.m. Option D. 10:30 p.m. 11:30 p.m. The correct answer is option B. 2:30 p.m. 4:30 p.m. A. This time describes the time of onset of NPH insulin's action rather than its peak effect. B. NPH insulin, an intermediate-acting insulin, usually begins to lower serum glucose levels about 2 hours after administration. The action of NPH insulin peaks 814 hours after administration. It has a 2030-hour duration. C. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. D. The time stated is not the time of peak action for NPH insulin administered at 6:30 a.m. Question 41. After several days, an item client's serum glucose stabilizes and the registered nurse continues client teaching in preparation for his discharge. The nurse helps him plan an American Diabetes Association diet and explains how foods can be substituted on the exchange list. He can substitute 1 oz of poultry for, here are the options. Option A, 1 Frankfurter. Option B, 1 ounce of ham. Option C, 2 slices of bacon. Option D, 1/4 cup dry cottage cheese. The correct answer is option D, 1/4 cup dry cottage cheese. A Frankfurter is a high-fat meat on the diabetic exchange list. B. Ham is a medium-fat meat on the diabetic exchange list, unless it is a center-cut slice. C. 1 strip of bacon equals 1 fake exchange rather than a make exchange. Dietary substitutions should occur within exchange lists and not between exchange lists. D. Diabetic meat exchange lists are categorized into lean meat foods, medium-fat meats, and high-fat meats. Cottage cheese dry, 2% butterfat, 1/4 cup, can substitute for 1 lean meat exchange. Question 42. When discussing the relationship between exercise and insulin requirements, a 26-year-old client with items should be instructed that, here are the options. Option A. When exercise is increased, insulin needs are increased. Option B. When exercise is increased, insulin needs are decreased. Option C. When exercise is increased, there is no change in insulin needs. Option D. When exercise is decreased, insulin needs are decreased. The correct answer is option B. When exercise is increased, insulin needs are decreased. A. If the client's insulin is increased when activity level is increased, hypoglycemia may result. B. Exercise decreased the blood sugar by promoting uptake of glucose by the muscles. Consequently, less insulin is needed to metabolize ingested carbohydrates. Extra food may be required for extra activity. C. This statement directly contradicts the correct answer and is inaccurate. D. When exercise is decreased, the client's insulin dose does not need to be altered unless the blood sugar becomes unstable. Question 43. A 64-year-old client is admitted to the hospital with benign prostatic hypertrophy (BPH). He has a history of adult-onset diabetes and hypertension and is scheduled to undergo a resection of the prostate. When recording his health history, the nurse asks about his chief complaint. The most serious symptom that may accompany BPH is, here are the options. Option A. Acute urinary retention. Option B. Hesitancy in starting urination. Option C. Increased frequency of urination. Option D. Decreased force of the urinary stream. The correct answer is option A. Acute urinary retention. Acute urinary retention requires urgent medical attention. If measures such as a warm tub bath or warm tea do not occur after 6 hours, the client should go to the ED for catheterization. B. C. D. This choice is a symptom of BPH, but is not serious or life-threatening. Question 44. A client undergoes a transurethral resection, prostate TUR. He returns from surgery with a 3-way continuous Foley irrigation of normal saline in progress. The purpose of this bladder irrigation is to prevent. Here are the options. Option A. Bladder spasms. Option B. Clot formation. Option C. Scrotal edema. Option D. Prostatic infection. The correct answer is option B. Clot formation. And the purpose of bladder irrigation is not to prevent bladder spasms, but to drain the bladder and decrease clot formation and obstruction. A 3-way system of bladder irrigation will cleanse the bladder and prevent formation of blood clots. A catheter obstructed by clots or other debris will cause prostatic distension and hemorrhage. C. Scrotal edema seldom occurs after TUR. Bladder irrigation will not prevent this complication. D. Prostatic infection seldom occurs after TUR. Bladder irrigation will not prevent this complication. Question 45. Following TURP, which of the following instructions would be appropriate to prevent or alleviate anxiety concerning the client's sexual functioning? Here are the options. Option A. You may resume sexual intercourse in 2 weeks. Option B. Many men experience impotence following TURP. Option C. A transurethral resection does not usually cause impotence. Option D. Check with your doctor about resuming sexual activity. The correct answer is option C. A transurethral resection does not usually cause impotence. A sexual activity should be delayed until cleared by the client's physician. B. Although many men experience retrograde ejaculation following prostate surgery, potency is seldom affected. C. Although the client may experience retrograde ejaculation, it will not limit his ability to engage in sexual intercourse. D. Although the client should obtain clearance from his physician before resuming sexual activity, this statement does not give the client any information or reassurance about future sexual activity or potency that could decrease his anxiety. Question 46. A client is having an amniocentesis. Prior to the procedure, an ultrasound is performed. In preparing the client, the nurse explains the reason for a sonogram in this situation to be. Here are the options. Option A. Determination of multiple gestations. Option B. Determination of gross anomalies. Option C. Determination of placental location. Option D. Determination of fetal age. The correct answer is option C. Determination of placental location. A sonography can be used to determine the presence of multiple gestation. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. B. Sonography can be used to determine the presence of gross anomalies. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. C. Prior to amniocentesis, the abdomen is scanned by ultrasound to locate the placenta, thus reducing the possibility of penetrating it with the spinal needle used to obtain amniotic fluid. D. Sonography can be used to determine fetal age. In this question, the sonogram is used as a preparatory step for a specific invasive procedure. Question 47. A client is resting comfortably after delivering her first child. When assessing her pulse rate, the nurse would recognize the following finding to be typical. Here are the options. Option A. Thready pulse. Option B. Irregular pulse. Option C. Tachycardia. Option D. The bradycardia. The correct answer is option D, bradycardia. A thready pulse is indicative of hypotension and excessive blood loss and is often rapid. B. Pulse irregularities or dysrhythmias do not occur in the normal postpartum woman. C. Tachycardia occurs less frequently than bradycardia and is related to increased blood loss or prolonged difficult labor and or birth. D. Puerperal bradycardia with rates of 5,070 bpm commonly occurs during the first 610 days of the postpartum period. It may be related to decreased cardiac strain, decreased blood volume, contraction of the uterus, and increased stroke volume. Question 48. A client is being admitted to the labor and delivery unit. She has had previous admissions for false labor. Which clinical manifestation would be most indicative of true labor? Here are the options. Option A. Increased bloody show. Option B. Progressive dilatation and effacement of the cervix. Option C. Uterine contractions. Option D. Decreased discomfort with ambulation. The correct answer is option B. Progressive dilatation and effacement of the cervix. A bloody show is considered a sign of imminent labor, which usually begins in 2,448 hours. An increase in bloody show is an indication that the cervix is changing. B. Contractions of true labor produce progressive cervical effacement and dilatation. C. Contractions of false labor may mimic those of true labor. However, the contractions of false labor do not produce progressive effacement and dilatation of the cervix. D. In true labor, the discomfort is not relieved by ambulation. Walking may intensify the discomfort. Question 49. In evaluating the effectiveness of magnesium sulfate MgSO4, which of the following might indicate that the client was developing MgSO4 toxicity? Here are the options. Option A. A 31 patellar tendon reflex. Option B. Respirations of 12 breaths/min. Option C. Urine output of 40 ml/hr. Option D. A 21 proteinuria value. The correct answer is option B. Respirations of 12 breaths/min. A diminished, not accentuated patellar tendon reflex is a sign of developing MgSO4 toxicity. A value of 21 is considered a normal tendon reflex. 3+ is considered brisker than normal. The MgSO4 is a central nervous system CNS depressant. It also relaxes smooth muscle. If the respiratory rate is 16 bpm, magnesium toxicity may be developing. C. Urine output of 40 ml/hr is enough to allow elimination of toxic levels of magnesium. Urinary output of 100 ml in a 4-hour period may result in toxic levels of magnesium. D. Presence of protein in the urine is a symptom of pregnancy-induced hypertension (PIH), a clinical syndrome for which magnesium sulfate is frequently used in medical management. Protein in the urine is not induced by magnesium sulfate intake. Question 50. A client has had amniocentesis. One of the tests performed on the amniotic fluid is a lecithin-sphingomyelin L/S ratio. The results show a ratio of 1:1. This is indicative of, here are the options. Option A. Lung immaturity. Option B. Intrauterine growth retardation (IGR). Option C. Intrauterine infection. Option D. Neural tube defect. The correct answer is option A. Lung immaturity. At about 3,032 weeks gestation, the amount of the surfactants, lecithin, and sphingomyelin become equal. As the fetal lungs mature, the concentration of lecithin begins to exceed that of sphingomyelin. At 35 weeks, the L/S ratio is 2:1. Respiratory distress syndrome is unlikely if birth occurs at this time. B-ILGR is associated with compromised uteroplacental perfusion or with viral infections, chromosomal disorders, congenital malformations, and maternal malnutrition. ILGR is not specifically assessed by analysis of the L/S ratio. C. Analysis of the L/S ratio is not an assessment used to confirm intrauterine infection. D. Elevated levels of fetaprotein in maternal serum or in amniotic fluid have been found to reflect open neural tube defects, such as spina bifida and anencephaly. Question 51. On admission to the postpartum unit, the nurse's assessment identifies the client's fundus to be soft, 2 finger breadths above the umbilicus and deviated to the right. This is most likely an indication of, here are the options. Option A, normal involution. Option B, a full bladder. Option C, an infection pain. Option D, a hemorrhage. The correct answer is option B, a full bladder. Immediately after expulsion of the placenta, the fundus should be in the midline and remain firm. A boggy displaced uterus in the immediate postpartum period is a sign of urinary distension. Because uterine ligaments are stretched, a full bladder can displace the uterus. Symptoms of infection may include unusual uterine discomfort, temperature elevation, and foul-smelling lochia. The stem of this question does not address any of these factors. D. While excessive bleeding is associated with a soft, boggy uterus, the stem of this question includes displacement of the uterus, which is more commonly associated with bladder distension. Question 52. A client's membranes have just ruptured spontaneously. Which of the following nursing actions should take priority? Here are the options. Option A, assess quantity of fluid. Option B, assess color and odor of fluid. Option C, document on fetal monitor strip and chart. Option D, assess fetal heart rate FHR. The correct answer is option D, assess fetal heart rate FHR. Assessing the quantity of amniotic fluid is important as an indication of maternal fetal well-being, but it does not take priority over assessment of FHR. B. Greenish-brown discoloration of amniotic fluid indicates presence of meconium. Foul odor may indicate presence of infection. Both of these are important assessment data, but they do not take priority over possible life-threatening compression of the umbilical cord. C. Documentation is important, but it does not take priority over the possible life-threatening compression of the umbilical cord. D. If changes in the FHR are noted, the nurse should check for umbilical cord prolapse. This intervention has priority over the other actions. The danger of a prolapsed cord is increased once membranes have ruptured, especially if the presenting part of the fetus does not fit firmly against the cervix. Question 53. The nurse and prenatal client discuss the effects of cigarette smoking on pregnancy. It would be correct for the nurse to explain that with cigarette smoking there is increased risk that the baby will have. Here are the options. Option A, a low birth weight. Option B, a birth defect. Option C, anemia. Option D, nicotine withdrawal. The correct answer is option A, a low birth weight. Women who smoke during pregnancy are at increased risk for miscarriage, preterm labor, and ILGR in the fetus. B. Although smoking produces harmful effects on the maternal vascular system and the developing fetus, it has not been directly linked to fetal anomalies. C. Smoking during pregnancy has not been directly linked to anemia in the fetus. D. Smoking during pregnancy has not been linked to nicotine withdrawal symptoms in the newborn. Question 54. Which of the following blood values would require further nursing action in a newborn who is 4 hours old? Here are the options. Option A. Hemoglobin 17.2 g/dl. Option B. Platelets 250,000/mm3. Option C. Serum glucose 30 mg/dl. Option D. White blood cells 18,000/mm3. The correct answer is option C. Serum glucose 30 mg/dl. The normal range for hemoglobin in the newborn is 1,719 g/dl. 17.2 g/dl is within normal limits. B. A normal value range for platelets in the newborn is 150,000/400 mm3. 250,000/mm3 is within normal range. C. Is serum glucose of 30 mg/dl in the first 72 hours of life is indicative of hypoglycemia and warrants further intervention. D. On the day of birth, a white blood cell count of 18,000/40/mm3 is normal in the newborn. Question 55. A client is admitted to the psychiatric unit after lavage and stabilization in the emergency room for an overdose of antidepressants. This is her third attempt in 2 years. The highest priority intervention at this time is to. Here are the options. Option A. Assess level of consciousness. Option B. Assess suicide potential. Option C. Observe for sedation and hypotension. Option D. Orient to her room and unit rules. The correct answer is option B. Assess suicide potential. If the client was stabilized in the ED and consequently would not be sent to the psychiatric unit if comatose. B. Suicide assessment is always appropriate for clients with a history of previous attempts or depression, because either of these factors places the client at high risk. C. The admission assessment should include observation for sedation and hypotension, but this is not in priority over suicide assessment. D. Orientation to room and unit rules is of low priority at this time. Question 56. A client's record from the ED indicates that she overdosed on phenylzine sulfate nardo, a monoamine oxidase MAO inhibitor. Which diet would be the most appropriate at this time? Here are the options. Option A. High carbohydrate, low cholesterol. Option B. High protein, high carbohydrate. Option C. 1G sodium. Option D. Tyramine free. The correct answer is option D. Tyramine free. A. There are no data to support the need for increased carbohydrates or decreased cholesterol in the diet. B. There is no data to support the need for increased protein or increased carbohydrates in the diet. C. There is no assessment or laboratory data indicating that sodium should be restricted in the diet. D. Tyramine is an amino acid activated by MAO in the liver and intestinal wall. It is released as proteins are hydrolyzed through aging, pickling, smoking, or spoilage of foods. When MAO is inhibited, tyramine levels rise, stimulating the adrenergic system to release large amounts of norepinephrine, which can produce a hypertensive crisis. Question 57. 2 weeks after a client's admission for depression, the physician orders a consult for electroconvulsive therapy ECT. Which of the following conditions, if present, would be a contraindication for ECT? Here are the options. Option A, brain tumor or other space-occupying lesion. Option B, history of mitral valve prolapse. Option C, surgically repaired herniated lumbar disc. Option D, history of frequent urinary tract infections. The correct answer is option A, brain tumor or other space-occupying lesion. A contraindication for ECT is a space-occupying lesion such as a brain tumor. During ECT, intracranial pressure increases. Therefore, ECT would not be prescribed for a client whose intracranial pressure is already elevated. B. Any cardiac dysrhythmias or complications that arise during ECT are usually attributed to the Roman IV anesthetics used, not to pre-existing cardiac structural conditions. C. Musculoskeletal injuries during ECT are extremely rare because of the Roman IV use of centrally acting muscle relaxers. D. A history of any kind of infection would not contraindicate the use of ECT. In fact, concurrent treatment of infections with ECT is not uncommon. Question 58. A client is medically cleared for ECT and is tentatively scheduled for 6 treatments over a 2-week period. Her husband asks, "Isn't that a lot?" The nurse's best response is, "Here are the options." Option A, "Yes, that does seem like a lot." Option B, "You'll have to talk to the doctor about that. The physician knows what's best for the client." Option C, 6 to 10 treatments are common. Are you concerned about permanent effects? Option D, "Don't worry. Some clients have lots more than that." The correct answer is option C. 6 to 10 treatments are common. Are you concerned about permanent effects? This response indicates that the nurse is unsure of herself and not knowledgeable about ECT. It also reinforces the husband's fears. B. This response is passing the buck unnecessarily. The information needed to appropriately answer the husband's question is well within the nurse's knowledge base. C. The most common range for affective disorders is 610 treatments. This response confirms and reinforces the physician's plan for treatment. It also opens communication with the husband to identify underlying fears and knowledge deficits. D. This response offers false reassurance and dismisses the husband's underlying concerns about his wife. Question 59. A husband asks if he can visit with his wife on her ECT treatment days and what to expect after the initial treatment. The nurse's best response is, "Here are the options." Option A, "You'll have to get permission from the physician to visit. Clients are pretty sick after the first treatment." Option B, "Visitors are not allowed. We will telephone you to inform you of her progress." Option C, "There's really no need to stay with her. She's going to sleep for several hours after the treatment." Option D, "Yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment." The correct answer is option D. Yes, you may visit. She may experience temporary drowsiness, confusion, or memory loss after each treatment. It is within the nurse's realm of practice to grant visiting privileges according to hospital policy. ECT treatments do not make clients sick. The visitors are allowed and encouraged, particularly family members. C. Clients are usually awake within 1 hour post-treatment. Drowsiness wanes as the anesthetic wears off. D. A family member is encouraged to stay with the client after return to the unit. The nurse has used an opportunity to do family teaching and allay fears by explaining temporary side effects of the treatment. Question 60. A client is placed in 5-point restraints after exhibiting sudden violence after illegal drug use, and haloperidol haldolphide (NGN) is administered. After 1 hour, his behavior is more subdued, but he tells the nurse, "The devil followed me into this room. I see him standing in the corner with a big knife. When you leave the room, he's going to cut out my heart." The nurse's best response is, "Here are the options. Option A. I know you're feeling frightened right now, but I want you to know that I don't see anyone in the corner." Option B. You'll probably see strange things for a while until the PCP wears off. Option C. Try to sleep. When you wake up, the devil will be gone. Option D. You're probably feeling guilty because you used illegal drugs tonight. The correct answer is option A. I know you're feeling frightened right now, but I want you to know that I don't see anyone in the corner. A. The nurse is the client's link to reality. This response validates the authenticity of the client's experience by casting doubt on his belief and reinforcing reality. B. Although this statement may be literally correct, it is non-therapeutic because it lacks validation. C. This response encourages the client to attempt to do something that may be impossible at this time, offers false reassurance, and reinforces delusional content. D. The nurse is making an incorrect assumption about the client's feelings by offering a non-therapeutic interpretation of the motivation for the client's actions. Question 61. A violent client remains in restraints for several hours. Which of the following interventions is most appropriate while he is in restraints? Here are the options. Option A. Give fluids if the client requests them. Option B. Assess skin integrity and circulation of extremities before applying restraints and as they are removed. Option C. Measure vital signs at least every 4 hours. Option D. Release restraints every 2 hours for client to exercise. The correct answer is option D. Release restraints every 2 hours for client to exercise. A fluids nourishment should be offered at regular intervals whether the client requests or refuses them or not. B. Skin integrity and circulation of the extremity should be checked regularly while the client is restrained, not only before restraints are applied and after they are removed. C. Vital signs should be checked at least every 2 hours. If the client remains agitated in restraints, vital signs should be monitored even more closely, perhaps every 12 hours. D. Restraints should be released every 2 hours for exercise, one extremity at a time, to maintain muscle tone, skin and joint integrity, and circulation. Question 62. After 7 hours in restraint and a total of 30 mg haloperidol in divided doses, a client complains of stiffness in his neck and his tongue pulling to one side. These extrapyramidal symptoms EPS will most likely be relieved by the administration of. Here are the options. Option A. Lorazepam Ativan. Option B. Benztropine Cogentin. Option C. Thiothixine Navane. Option D. Florazepam Dalmane. The correct answer is option B. Benztropine Cogentin. A lorazepam is an anti-anxiety agent that produces muscle relaxation and inhibits cortical and limbic arousal. It has no action in the basal ganglia of the brain. B. Benztropine acts to reduce EPS by blocking excess CNS cholinergic activity associated with dopamine deficiency in the basal ganglia by displacing acetylcholine at the receptor site. C. Thiothixine is an antipsychotic known to block dopamine in the limbic system, thereby causing EPS. D. Florazepam is a hypnotic that acts in the limbic system, thalamus, and hypothalamus of the CNS to produce sleep. It has no known action in the basal ganglia. Question 63. Medication is administered to a client who has been placed in restraints after a sudden violent episode and his EPSs subside. Restraints can be removed when. Here are the options. Option A. The physician orders it. Option B. A therapeutic alliance has been established and violent behavior subsides. Option C. The violent behavior subsides and the client agrees to behave. Option D. The nurse deems that removal of restraints is necessary. The correct answer is option B. A therapeutic alliance has been established and violent behavior subsides. A. The physician may order release of restraints, but prior to that, the client must meet criteria for release. B. While the client is still restrained, but after violent behavior has subsided, a therapeutic bridge is built. This alliance encourages dialogue between nurse and client, allowing the client to determine causative factors, feelings prior to loss of control, and adaptive alternatives to violence. C. If the client only agrees to behave after violent behavior subsides, he has developed no insight into cause and effect of violence or his response to stress. D. Removal of restraints occurs only when the client meets the criteria for release, not just because the nurse says it is necessary. Question 64. A 16-year-old female client is admitted to the hospital because she collapsed at home while exercising with videotaped workout instructions. Her mother reports that she has been obsessed with losing weight and staying slim since cheerleader tryouts 6 months ago, when she lost out to 2 of her best friends. The client is 5'4" and weighs 92 lb, which represents a weight loss of 28 lb over the last 4 months. The most important initial intervention on admission is to. Here are the options. Option A. Obtain an accurate weight. Option B. Search the client's purse for pills. Option C. Assess vital signs. Option D. Assign her to a room with someone her own age. The correct answer is option C. Assess vital signs. A. On admission, vital signs are the highest priority. Weight is not a vital sign. B. Belongings are routinely searched on admission to a psychiatric unit, but the search is not a high priority. C. Vital signs are a high priority when working with self-destructive clients. D. Room assignment is of low priority. Question 65. Assessment of a client reveals a 30% loss of pre-illness weight, lanugo, and cessation of menses for 3 months. Her vital signs are BP 90/50, P96 BPM, respirations 30, and temperature 97 F. She admits to the nurse that she has induced vomiting 3 times this morning, but she had to continue exercising to lose just 5 more lb. Her symptoms are consistent with. Here are the options. Option A. Pregnancy. Option B. Bulimia. Option C. Gastritis. Option D. Anorexia nervosa. The correct answer is option D. Anorexia nervosa. A. Presenting behaviors collectively are inconsistent with depression. B. A pre-illness weight loss of 30%, lanugo, and cessation of menses are inconsistent with bulimia. C. Symptoms and vital signs do not indicate the presence of infection. D. All symptoms and vital signs are consistent with anorexia nervosa. Question 66. Blood work reveals the following lab values for a client who has been diagnosed with anorexia nervosa. Hemoglobin 9.6 G/DL, hematocrit 27%, potassium 2.7 mx/L, sodium 126 mx/L. The greatest danger to her at this time is. Here are the options. Option A. Hypoglycemia from low carbohydrate intake. Option B. Possible cardiac dysrhythmias secondary to hypokalemia. Option C. Dehydration from vomiting. Option D. Anoxia secondary to anemia. The correct answer is option B. Possible cardiac dysrhythmias secondary to hypokalemia. There is no lab data to support hypoglycemia. B. Hypokalemia, caused by vomiting and decreased dietary intake of potassium, can result in life-threatening dysrhythmias. C. Evidence of dehydration is not life-threatening at this time, although fluid volume deficit does need to be addressed. D. The client's hemoglobin does not reflect a life-threatening value sufficient to render the client anoxic. Question 67. A client suspected of having anorexia nervosa is placed on bed rest with Enromin 4 infusion and a high-carbohydrate liquid diet. Within 72 hours, the results of her lab work show a return to normal limits. She is transferred to the psychiatric service for further treatment. A behavior modification plan is initiated. 3 days after her transfer, the client tells the nurse, "I haven't exercised in 6 days. I won't be eating lunch today." This statement by her most likely reflects, here are the options. Option A. Her lack of internal awareness about the outcome of the behavior. Option B. Increased knowledge about personal exercise plans. Option C. A manipulative technique to trick the nurse into allowing her to miss a meal. Option D. A true desire to stay fit while in the hospital. The correct answer is option A. Her lack of internal awareness about the outcome of the behavior. A indirect self-destructive behavior such as that seen in anorexia nervosa is characterized by the client's lack of insight and the awareness that the outcome of the dieting, exercising, and weight loss will ultimately result in death if uninterrupted. B. Although the client is knowledgeable about exercise, knowledge about the balance between nutrition, exercise, and rest is absent. C. The client's level of denial and lack of awareness disallow this behavior as a manipulative trick. D. The client's illness-maintaining behaviors are inconsistent with fitness. Question 68. A client who has been diagnosed with anorexia nervosa refuses to eat lunch. The most therapeutic response by the nurse to her refusal is, here are the options. Option A. Okay, missing one meal won't hurt. Option B. You'll have to eat lunch or we'll force feed you. Option C. It's not appropriate for you to try to manipulate the staff into granting your wishes. Option D. We will not allow you to starve yourself. You may choose to eat voluntarily or be fed. The correct answer is option D. We will not allow you to starve yourself. You may choose to eat voluntarily or be fed. This response reinforces the client's maladaptive behavior, thereby contributing to the client's risk. B. Ultimatums are not therapeutic. C. This comment invites an argument because it puts the client on the defensive and stabs at her self-esteem, which is already compromised. D. Setting limits assures the client that staff has genuine concern for her safety and well-being. Giving her an actual choice will give the client an increased sense of control over her life and avoid an argument or power struggle. Question 69. A client who has been diagnosed with anorexia nervosa reluctantly agrees to eat all prescribed meals. The most important intervention in monitoring her dietary compliance would be to, here are the options. Option A. Allow her privacy at mealtimes. Option B. Praise her for eating everything. Option C. Observe behavior for 12 hours after meals to prevent vomiting. Option D. Encourage her to eat in moderation, choose foods that she likes, and avoid foods that she dislikes. The correct answer is option C. Observe behavior for 12 hours after meals to prevent vomiting. Eating alone is not recommended for anorexic clients because they tend to hoard food instead of eating it. The client should be praised for whatever she eats, which is usually a small portion or percentage of what is served. Praise should not be withheld until she eats everything. The client should be observed eye to eye for at least 1 hour following meals to prevent discarding food stashed in her clothing at mealtime or engaging in self-induced vomiting. If offered these choices, the client would choose low-caloric foods, not a nutritious diet. Question 70. A 2-year-old boy fell out of bed and has a subdural hematoma. When his mother leaves him for the first time, you will expect the child to. Here are the options. Option A. Be comforted when he is held. Option B. Cry. Option C. Not notice that his mother has left. Option D. Withdraw and become listless. The correct answer is option B. Cry. It will be difficult to comfort a 2-year-old with a headache without his mother. This baby probably will cry, which should be prevented because it will increase his intracranial pressure (ICP). Asking the mother to wait until the baby is asleep may help. An awake 2-year-old will notice when his mother leaves. An older child may withdraw when feeling afraid, but a 2-year-old will probably show more aggressive behavior. Question 71. The doctor has ordered a restricted fluid intake for a 2-year-old child with a head injury. Normal fluid intake for a child of 2 years is. Here are the options. Option A. 900 ml/24 hr. Option B. 1,300 ml/24 hr. Option C. 1,600 ml/24 hr. Option D. 2,000 ml/24 hr. The correct answer is option C. 1,600 ml/24 hr. A, B, D. These values are incorrect. Normal intake for a child of 2 years is about 1,600 ml in 24 hours. This value is correct. Normal intake for a child of 2 years is about 1,600 ml in 24 hours. Question 72. A 2-year-old child with a scalp laceration and subdural hematoma of the temporal area as a result of falling out of bed should be prevented from. Here are the options. Option A. Crying. Option B. Falling asleep. Option C. Rolling from his back to his tummy. Option D. Sucking his thumb. The correct answer is option A. Crying. A child with a subdural hematoma has increased ICP. Crying may significantly increase this pressure. Adequate sleep is essential, but it is important that the child can be aroused from sleep after head injury. This child is free to roll from his back to his abdomen. Thumb sucking serves to reduce anxiety and should not be prevented at this time. Question 73. A 7th grader lost consciousness after being hit in the head with a basketball. In the emergency room, his vital signs are stable and he demonstrates no neurologic deficit. He will not be admitted to the hospital. It is most important that you advise his mother to. Here are the options. Option A. Encourage him to drink plenty of fluids. Option B. Expect him to have nausea with vomiting. Option C. Keep him awake for the next 12 hours. Option D. Wake him up every 12 hours during the night. The correct answer is option D. Wake him up every 12 hours during the night. A fluid intake should be normal. Fluid intake may be restricted when there is a risk for increased ICP in a hospitalized client. Nausea is possible, but vomiting without nausea is more likely with increased ICP. Neither one should be expected, but the mother should know to notify the physician or hospital if they occur. C. The child does not need to be kept awake. It is important that he can be aroused from sleep. D. If the child cannot be awakened from sleep after head injury, it is an indication of serious increase in ICP. The mother should call an ambulance right away. Question 74. A 14-year-old boy fell off his bike while popping a wheelie on the dirt trails. He has sustained a head injury with laceration of his scalp over his temporal lobe. If you were to complain of headache during the first 24 hours of his hospitalization, the nurse would. Here are the options. Option A. Ask the physician to order a sedative. Option B. Have the client describe his headache every 15 minutes. Option C. Increase his fluid intake to 3,000 ml/24 hr. Option D. Offer diversionary activities. The correct answer is option D. Offer diversionary activities. CNS depressants are not given for headache due to head injury because they would mask changes in neurological status and because they could further depress the CNS. B. The client should not be asked to think about his headache every 15 minutes. C. Fluid intake should be normal or restricted for a client with a head injury. Normal fluid intake for a 14-year-old is about 20,002,400 ml daily. D. Diversion may help the child to focus on a pleasant activity instead of on his headache. Question 75. An 18-year-old girl is admitted to the hospital with a depressed skull fracture as a result of a car accident. If the nurse were to observe a rising pulse rate and lowering blood pressure, the nurse would suspect that the client. Here are the options. Option A. Has a sudden and severe increase in intracranial pressure. Option B. Has sustained an internal injury in addition to the head injury. Option C. Is beginning to experience a dangerously high level of anxiety. Option D. Is having intracranial bleeding. The correct answer is option B. Has sustained an internal injury in addition to the head injury. A widening pulse pressure, high systolic and low diastolic with compensatory slowing of pulse rate are late signs of increasing ICP. The rising pulse rate and lowering blood pressure are indicative of hypovolemia due to hemorrhage. C. High anxiety in the absence of hemorrhage would result in a high pulse rate and a high blood pressure. D. Intracranial bleeding results in increased ICP. A change in level of consciousness is an early sign of increasing ICP, and vital sign changes are late signs of increasing ICP. Question 76. The nurse is caring for a 2-year-old girl with a subdural hematoma of the temporal area as a result of falling out of bed and notices that she has a runny nose. The nurse should. Here are the options. Option A. Call the doctor immediately. Option B. Help her to blow her nose carefully. Option C. Test the discharge for sugar. Option D. Turn her to her side. The correct answer is option C. Test the discharge for sugar. The nasal discharge could be due to a cold. It is necessary to gather additional assessment data to identify a possible cerebrospinal fluid leak. B. If the discharge is cerebrospinal fluid, it would not be safe to encourage the girl to blow her nose. C. Cerebrospinal fluid is positive for sugar, mucus is not. D. Turning her to her side will have no effect on her runny nose. It is necessary to gather further assessment data. Question 77. A 2-year-old boy is in a hospital outpatient department for observation after falling out of his crib and hitting his head. The nurse calls the physician to report. Here are the options. Option A. Evidence of perineal irritation. Option B. Pulse fell from 102 to 96. Option C. Pulse increased from 96 to 102. Option D. Temperature rose to 102 F rectally. The correct answer is option D. Temperature rose to 102 F rectally. A perineal irritation needs to be addressed, but is probably not necessary to call the physician. This fall in pulse rate remains within normal limits and is probably insignificant. It is important to monitor for continued change. C. This rise in pulse rate is probably not significant, but it is important to monitor for continued change. D. This temperature is above normal limits and needs medical investigation. It may or may not be related to the head injury. Question 78. The nurse is caring for a 3-month-old girl with meningitis. She has a positive Kernig's sign. The nurse expects her to react to discomfort if she. Here are the options. Option A. Dorsiflexes her ankle. Option B. Flexes her spine. Option C. Plantarflexes her wrist. Option D. Turns her head to the side. The correct answer is option B. Flexes her spine. A discomfort with ankle dorsiflexion is not expected with meningitis. B. Spinal flexion, flexing the neck or the hips with legs extended, causes discomfort if the meninges are irritated. C. Discomfort with wrist flexion is not expected with meningitis. D. Rotating the cervical spine may cause discomfort with meningitis, but pain with flexion is more indicative of meningeal irritation. Question 79. The nurse is admitting an infant with bacterial meningitis and is prepared to manage the following possible effects of meningitis. Here are the options. Option A. Constipation. Option B. Hypothermia. Option C. Seizure. Option D. Sunken fontanelles. The correct answer is option C. Seizure. A constipation may occur if the child is dehydrated, but it is not directly associated with meningitis. B. It's more likely the child will have fever. C. Seizure is often the initial sign of meningitis in children and could become frequent. D. It is more likely the child will have bulging fontanelles. Question 80. The nurse is caring for a 6-week-old girl with meningitis. To help her develop a sense of trust, the nurse should. Here are the options. Option A. Give her a small soft blanket to hold. Option B. Give her good perineal care after each diaper change. Option C. Leave the door open to her room. Option D. Pick her up when she cries. The correct answer is option D. Pick her up when she cries. A soft blanket may be comforting, but it is not directed toward developing a sense of trust. B. Good perineal care is important, but it is not directed toward developing a sense of trust. C. An infant with meningitis needs frequent attention, but leaving the door open does not foster trust. D. Consistently picking her up when she cries will help the child feel trust in her caregivers. Question 81. A 6-year-old girl is visiting the outpatient clinic because she has a fever and a rash. The doctor diagnoses chickenpox. Her mother asks the nurse how many baby aspirins her daughter can have for fever. The nurse should. Here are the options. Option A. Advise the mother not to give her aspirin. Option B. Ask if the client is allergic to aspirin before giving further information. Option C. Assess the function of the client's cranial nerve Roman 8. Option D. Check the aspirin bottle label to determine milligrams per tablet. The correct answer is option A. Advise the mother not to give her aspirin. Aspirin taken during a viral infection has been implicated as a predisposing factor to Ray's syndrome in children and adolescents. Children and adolescents should not be given aspirin. The allergy to aspirin is not related to Ray's syndrome. C. Tinnitus, caused by damage to the acoustic nerve, occurs with aspirin toxicity, but this is not related to Ray's syndrome. D. A 6-year-old child should not be given any baby aspirin. Question 82. A 2-year-old child is recovering from surgery. Considering growth and development according to Erickson, the nurse identifies which of the following play activities as most appropriate. Here are the options. Option A. Assembling a puzzle with large pieces. Option B. Being taken for a wheelchair ride. Option C. Listening to a story about the Muppets. Option D. Watching Sesame Street on television. The correct answer is option A. Assembling a puzzle with large pieces. A 2-year-old child is in the stage of autonomy according to Erickson. Assembling a puzzle with large pieces enables her to do it herself. A wheelchair ride would probably be fun, but it is not directed toward helping the child to achieve autonomy. C. Listening to a story may be fun and educational, but it is not directed toward helping the child to achieve autonomy. D. Watching television may be a favorite activity, but it does not foster autonomy. Question 83. A 14-year-old boy has a head injury with laceration of his scalp over his ear. The nurse should call the physician to report. Here are the options. Option A. Blood pressure increase from 100/80 to 115/85 after lunch. Option B. Headache that is unresponsive to acetaminophen Tylenol. Option C. Pulse rate ranges between 68 bpm and 76 bpm. Option D. Temperature rise to 102 F rectally. The correct answer is option D. Temperature rise to 102 F rectally. This change in blood pressure may not be significant and does not indicate a widening pulse pressure, a late sign of increased ICP. It is important to continue to monitor for change in blood pressure. Acetaminophen may be ineffective in relieving headache after head injury. Stronger analgesics are contraindicated because they mask neurological signs and may depress the CNS. C. Pulse rates between 68 bpm and 76 bpm are within normal limits for a 14-year-old child. It is important to monitor for a consistent drop in pulse rate, which is a late sign of increasing ICP. D. An elevated temperature is abnormal and requires further assessment and medical intervention. The temperature may be unrelated to the head injury, but CNS infection is serious and difficult to control. Topic 7. Questions Set G. Question 84. The nurse is teaching a child's parents how to protect the child from lead poisoning. The nurse knows that a common source of lead poisoning in children is. Here are the options. Option A. Dandelion leaves. Option B. Pencils. Option C. Old paint. Option D. Stuffing from toy animals. The correct answer is option C. Old paint. A. Dandelion leaves are not a source of lead. B. Pencils are not a source of lead poisoning. C. Chewing on objects painted before 1960 is a common source of lead poisoning in children. Gasoline is another source. D. Stuffed animals are not a source of lead. Question 85. A woman diagnosed with multiple sclerosis is disturbed with diplopia. The nurse will teach her to. Here are the options. Option A. Limit activities which require focusing close vision. Option B. Take more frequent naps. Option C. Use artificial tears. Option D. Wear a patch over one eye. The correct answer is option D. Wear a patch over one eye. Limiting activities requiring close vision will not alleviate the discomfort of double vision. Frequent naps may be comforting, but they will not prevent double vision. C. Artificial tears are necessary in the absence of a corneal reflex, but they have no effect on diplopia. D. An eye patch over either eye will eliminate the effects of double vision during the time the eye patch is worn. An eye patch is safe for a person with an intact corneal reflex. Question 86. In planning daily care for a client with multiple sclerosis, the nurse would take into consideration that multiple sclerosis. Here are the options. Option A. Becomes progressively debilitating without remission. Option B. Has unpredictable remissions and exacerbations. Option C. Is rapidly fatal. Option D. Responds quickly to antimicrobial therapy. The correct answer is option B. Has unpredictable remissions and exacerbations. Multiple sclerosis eventually becomes debilitating, but it is characterized by remission of symptoms. Remissions and exacerbations are unpredictable with multiple sclerosis. The client experiences progressive dysfunction after each exacerbation episode. C. Multiple sclerosis is usually slowly progressive. D. Multiple sclerosis is an autoimmune disease. Antimicrobial therapy has no effect on its course. Question 87. A client with a head injury asks why he cannot have something for his headache. The nurse's response is based on the understanding that analgesics could. Here are the options. Option A. Counteract the effects of antibiotics. Option B. Elevate the blood pressure. Option C. Mask symptoms of increasing intracranial pressure. Option D. Stimulate the central nervous system. The correct answer is option C. Mask symptoms of increasing intracranial pressure. An analgesic medication does not counteract the effects of antibiotics. Analgesic medication may lower blood pressure elevated due to anxiety. Analgesic medication, especially CNS depressants, is not given if there is danger of increasing ICP, because neurological changes may not be apparent. Also, further depression of the CNS is contraindicated. Analgesics do not stimulate the CNS. Question 88. To prevent transmission of bacterial meningitis, the nurse would instruct an infected baby's mother to. Here are the options. Option A. Avoid touching the baby while in the room. Option B. Stay outside of the baby's room. Option C. Wear a gown and gloves and wash her hands before and after leaving the room. Option D. Wear a mask while in the room. The correct answer is option C. Wear a gown and gloves and wash her hands before and after leaving the room. The mother should be allowed and encouraged to touch her baby. With care, transmission can be prevented. There is no need for the mother to stay outside the room. Everyone entering the baby's room should take appropriate measures to prevent transmission of pathogens. Wearing a mask will not protect against transmission of pathogens. Question 89. A client is scheduled for a magnetic resonance imaging MRI to locate a cerebral lesion. It is important for the nurse to find out if he has AN. Here are the options. Option A. Allergy to seafood. Option B. History of seizures. Option C. Movable metal implant. Option D. Pin or screw in any bone. The correct answer is option C. Movable metal implant. Iodine is not used as a contrast medium for MRI. It is important to inquire about allergy to seafood if the client is to have an arteriogram or enhanced computer tomography. The MRI is safe if seizures are under control. It is more important to inquire about movable metal implants. See clients with movable metal implants such as shrapnel or aneurysm clips, or clients with permanent pacemakers or implanted pumps can be traumatized during an MRI. The non-movable metal prostheses or hardware will not cause trauma during an MRI. Question 90. A child is admitted with severe headache, fever, vomiting, photophobia, drowsiness, and stiff neck associated with viral meningitis. She will be more comfortable if the nurse. Here are the options. Option A. Dims the lights in her room. Option B. Encourages her to breathe slowly and deeply. Option C. Offers sips of warm liquids. Option D. Places a large, soft pillow under her head. The correct answer is option A. Dims the lights in her room. The discomfort of photophobia is alleviated by dimming the lights. B. Helping the child to breathe slowly and deeply may help to reduce anxiety, but it will not alleviate other discomforts of viral meningitis. C. It is important to maintain fluid balance, but sips of warm liquids do not alleviate the discomforts of meningitis. D. A large, soft pillow under her head causing neck flexion is likely to increase her discomfort owing to stretching of the meninges. Question 91. A 30-year-old client has been admitted to the psychiatric service with the diagnosis of schizophrenia. He tells the nurse that when the woman he had been dating broke up with him, the CIA had replaced her with an identical twin. The client is experiencing. Here are the options. Option A. Grandiose delusions. Option B. Paranoid delusions. Option C. Auditory hallucinations. Option D. Visual hallucinations. The correct answer is option B. Paranoid delusions. A. There are no indications that the client's thoughts reflect special powers or talents characteristic of grandiosity. B. The client's thought content is fixed, false, persecutory, and suspicious in nature, which is characteristic of paranoid delusions. C. D. The client is not demonstrating a sensory experience. Question 92. A client tells the nurse that he has been hearing voices that tell him to kill his girlfriend because she is a spy. He further states that he is having difficulty not obeying the voices because, if he does not, his house will be burned down. The highest priority nursing diagnosis for him at this time is, here are the options. Option A. Sensory perceptual alteration, auditory command hallucinations. Option B. Alteration in thought processes, paranoid delusions. Option C. Potential for violence directed at others. Option D. Impaired verbal communication, loose associations. The correct answer is option C. Potential for violence directed at others. Although the client is having command hallucinations, this is second in priority to real or potential violence, which can be a threat to life itself. B. Although the client is experiencing delusions, this is also a lower priority than his potential or actual loss of control. C. Whether real or potential violence directed at self or others is always high priority. D. There is no evidence of loosening of associations. Question 93. A client reports to the nurse that the voices are practically non-stop and that he needs to leave the hospital immediately to find his girlfriend and kill her. The best verbal response to the client by the nurse at this time is, here are the options. Option A. I understand that the voices are real to you, but I want you to know I don't hear them. They are a symptom of your illness. Option B. Just don't pay attention to the voices. They'll go away after some medication. Option C. You can't leave here. This unit is locked and the doctor has not ordered your discharge. Option D. We will have to put you in seclusion and restraints for a while. You could hurt someone with thoughts like that. The correct answer is option A. I understand that the voices are real to you, but I want you to know I don't hear them. They are a symptom of your illness. This response validates the client's experience and presents reality to him. This non-therapeutic response minimizes and dismisses the client's verbalized experience. This response can be interpreted by a paranoid client as a threat, thereby increasing the client's potential for violence and loss of control. This response is also threatening. The client's behavior does not call for restraints because he has not lost control or hurt anyone. If seclusion or restraints were indicated, the nurse should never confront the client alone. Question 94. The physician orders haloperidol 5 mg IM stat for a client and tells the nurse that the dose can be repeated in 12 hours if needed. The most likely rationale for this order is, here are the options. Option A. The client will settle down more quickly if he thinks the staff is medicating him. Option B. The medication will sedate the client until the physician arrives. Option C. Haloperidol is a minor tranquilizer and will not over-sedate the client. Option D. Rapid neuroleptization is the most effective approach to care for the violent or potentially violent client. The correct answer is option D. Rapid neuroleptization is the most effective approach to care for the violent or potentially violent client. If the client could think logically, he would not be paranoid. In fact, he is probably suspicious of the staff, too. Newly admitted clients frequently experience high levels of anxiety, which can contribute to delusions. The goal of pharmacological intervention is to calm the client and assist with reality-based thinking, not to sedate him. Haloperidol is a neuroleptic and antipsychotic drug, not a minor tranquilizer. Haloperidol is a high-potency neuroleptic and first-line choice for rapid neuroleptization with low potential for sedation. Question 95. 2 hours after the second injection of haloperidol, a client complains to the nurse of a stiff neck and inability to sit still. He is experiencing symptoms consistent with, here are the options. Option A. Parkinsonism and dystonia. Option B. Dystonia and akathisia. Option C. Akathisia and Parkinsonism. Option D. Neuroleptic malignant syndrome. The correct answer is option B. Dystonia and akathisia. A stiff neck is consistent with a dystonic reaction, but the client has no symptoms of drooling, shuffling gait, or pill-rolling movements characteristic of Parkinsonism. Stiff neck is consistent with a dystonic reaction and an ability to sit still with varying degrees of psychomotor agitation is characteristic of akathisia. The client has symptoms of dystonia but not of Parkinsonism. The client has none of the characteristic symptoms of neuroleptic malignant syndrome, hyperpyrexia, generalized muscle rigidity, mutism, obtundation, agitation, sweating, increased blood pressure and pulse. Question 96. The physician orders medication for a client's unpleasant side effects from the haloperidol. The most appropriate drug at this time is, here are the options. Option A, lorazepam. Option B, triazolamhausen. Option C, venstropine. Option D, thiothixine. The correct answer is option C, venstropine. A lorazepam is a benzodiazepine or anti-anxiety agent that potentiates the effects of aminobutyric acid in the CNS, which is not the CNS neurotransmitter EPS. Triazolam is a benzodiazepine sedative hypnotic whose action is mediated in the limbic, thalamic, and hypothalamic levels of the CNS by aminobutyric acid. Benztropine is an anticholinergic agent and the drug of choice for blocking CNS synaptic response, which causes EPS. Thiothixine is an antipsychotic and neuroleptic drug that blocks dopamine neurotransmission at the CNS synapses, thereby causing EPS. Question 97. A psychiatric client has been stabilized and is to be discharged. The nurse will recognize client insight and behavioral change by which of the following client statements? Here are the options. Option A. When I get home, I will need to take my medicines and call my therapist if I have any side effects or begin to hear voices. Option B. If I have any side effects from my medicines, I will take an extra dose of Cogentin. Option C. When I get home, I should be able to taper myself off the Haldol because the voices are gone now. Option D. As soon as I leave here, I'm throwing away my medicines. I never thought I needed them anyway. The correct answer is option A. When I get home, I will need to take my medicines and call my therapist if I have any side effects or begin to hear voices. A. The client verbalizes that he is responsible for compliance and keeping the treatment team member informed of progress. This behavior puts him at the lowest risk for relapse. B. Non-compliance is a major cause of relapse. This statement reflects lack of responsibility for his own health maintenance. C. The statement reflects lack of insight into the importance of compliance. D. The statement reflects no insight into his illness or his responsibility in health maintenance. Question 98. The nurse is developing a plan of care for a client with an electrolyte imbalance and identifies a nursing diagnosis of decreased physical mobility. Which alteration is most likely the etiology? Here are the options. Option A. Hypernatremia. Option B. Hypocalcemia. Option C. Hypokalemia. Option D. Hypomagnesemia. The correct answer is option C, hypokalemia. A deficit in sodium concentration results in muscular weakness and lethargy. B. Muscle fatigue and hypotonia are caused by hypercalcemia. C. Muscle weakness and fatigue are classic signs of hypokalemia. D. Hypermagnesemia can cause muscle weakness, paralysis, and coma. Question 99. The nurse is assessing breath sounds in a bronchosiccular client. She should expect that. Here are the options. Option A. Inspiration is longer than expiration. Option B. Breath sounds are high-pitched. Option C. Breath sounds are slightly muffled. Option D. Inspiration and expiration are equal. The correct answer is option D. Inspiration and expiration are equal. A. Inspiration is normally longer in vesicular areas. B. High-pitched sounds are normal in bronchial area. C. Muffled sounds are considered abnormal. D. Inspiration and expiration are equal normally in this area and sounds are medium-pitched. Question 100. Discharge teaching for the client. who has a total gastrectomy should include which of the following? Here are the options. Option A. Need for the client to increase fluid intake to 3,000 ml/day. Option B. Follow-up visits every 3 weeks for the first 6 months. Option C. B12 injections needed for the rest of the client's life. Option D. Need to eat 3 full meals with plenty of fiber per day. The correct answer is option C. B12 injections needed for the rest of the client's life. There will be no need to increase fluid intake excessively because dumping syndrome could present a problem. The follow-up visits every 3 weeks are not a standard recommendation. Follow-up visits will be highly individualized. C. With removal of the stomach, intrinsic factor will no longer be produced. Intrinsic factor is necessary for vitamin B12 absorption. Parenteral injections of B12 will be needed on a monthly basis for the rest of the person's life. D. Smaller, more frequent meals rather than large, bulky meals are recommended to prevent problems with dumping syndrome. Question 101. Which of the following findings would necessitate discontinuing N-Roman-4 potassium infusion in an adult with ketoacidosis? Here are the options. Option A. Urine output 22 ml/hr for 2 hours. Option B. Serum potassium level of 3.7. Option C. Small T wave of ECG. Option D. Serum glucose level of 180. The correct answer is option A. Urine output 22 ml/hr for 2 hours. An adequate renal flow of 30 ml/hr is a necessity with potassium infusions because potassium is excreted renally. B. Because potassium level will decrease during correction of diabetic ketoacidosis, potassium will be infused even if plasma levels of potassium are normal. C. A small T wave is normal and desired on the electrocardiogram. A tall, peaked T wave could indicate overinfusion of potassium and hyperkalemia. D. Glucose levels of 200 are desirable. Question 102. A client is receiving Roman-4 morphine 2 days after colorectal surgery. Which of the following observations indicate that he may be becoming drug dependent? Here are the options. Option A. The client requests pain medicine every 4 hours. Option B. He is asleep 30 minutes after receiving the Roman-4 morphine. Option C. He asks for pain medication although his blood pressure and pulse rate are normal. Option D. He is euphoric for about an hour after each injection. The correct answer is option D. He is euphoric for about an hour after each injection. Frequent requests for pain medication do not necessarily indicate drug dependence after complex surgeries such as colorectal surgery. B. Sleeping after receiving Roman-4 morphine is not an unexpected effect because the pain is relieved. C. A person may be in pain even with normal vital signs. D. A subtle sign of drug dependency is the tendency for the person to appear more euphoric than relieved of pain. Question 103. The nurse assesses a postoperative mastectomy client and notes that breath sounds are diminished in both posterior bases. The nurse's action should be to. Here are the options. Option A. Encourage coughing and deep breathing each hour. Option B. Obtain arterial blood gases. Option C. Increase O2 from 23 L/min. Option D. Remove the postoperative dressing to check for bleeding. The correct answer is option A. Encourage coughing and deep breathing each hour. A decreased or absent breath sounds are frequently indicators of postoperative atelectasis. B. Arterial blood gases are not indicated because there is no other information indicating impending danger. C. Increasing O2 rate is not indicated without additional information. D. Removing the dressing is not indicated without additional information. Question 104. Which of the following should the nurse anticipate receiving as an as-needed order for a postoperative carotid endarterectomy client? Here are the options. Option A. Nitropine 10 mg SL for B/P140/90. Option B. Furosemide 20 mg/PO for decreased urine output. Option C. Magnesium salicylate to decrease inflammation. Option B. Nitroglycerin GR1/150 for chest pain. The correct answer is option A. Nitropine 10 mg SL for B/P140/90. It is important to maintain a normal to slightly lower pressure to prevent the graft from blowing and excessive pressure to surgical vascular areas. B, C, D. None of these drugs is related to managing the problem at hand. Also, none of the problems for which these drugs would be indicated is expected with this type of surgery, except if there's a prior history. Question 105. 3 hours postoperatively, a 27-year-old client complains of right leg pain after knee reduction. The first action by the nurse will be to. Here are the options. Option A. Assess vital signs. Option B. Elevate the extremity. Option C. Perform a lower extremity neurovascular check. Option D. Remind the client that he has a client-controlled analgesic pump and re-instruct him on its use. The correct answer is option C. Perform a lower extremity neurovascular check. A vital signs may be altered if there is acute pain or complications related to bleeding or swelling, but they should not be assessed before checking the affected extremity. B. The extremity will be elevated if ordered by the doctor. C. Assessment of the postoperative area is important to determine if bleeding, swelling, or decreased circulation is occurring. D. Reinforcement of teaching on use of the client-controlled analgesic pump is important, but not the first action. Question 106. Goal setting for a client with Meniere's disease should include which of the following? Here are the options. Option A. Frequent ambulation. Option B. Prevention of a fall injury. Option C. Consumption of 3 meals per day. Option D. Prevention of infection. The correct answer is option B. Prevention of a fall injury. Although not contraindicated, initially ambulation may be difficult because of vertigo and is recommended only with assistance. Vertigo resulting in balance problems is one of the most common manifestations of Meniere's disease. C. Adequate nutrition is important, but the emphasis in Meniere's disease is not the number of meals per day, but a decrease in intake of sodium. D. Infection is not an anticipated problem. Question 107. Which of the following physician's orders would the nurse question on a client with chronic arterial insufficiency? Here are the options. Option A. Neurovascular checks every 2 hours. Option B. Elevate legs on pillows. Option C. Arteriogram in the morning. Option D. No smoking. The correct answer is option B. Elevate legs on pillows. Neurovascular checks are a routine part of assessment with clients having this diagnosis. B. Elevation of the legs is contraindicated because it reduces blood flow to areas already compromised. C. Arteriogram is a routine diagnostic order. De-smoking is highly correlated with this disorder.